Hello, my name is Rebecca, and I'm going to show you what I learned about foreign accent syndrome. Foreign accent syndrome is an acquired, rare neurologic condition that can occur with or without any brain damage. It can affect different cortical and subcortical structures, causing a change in motor speech patterns. This unusual speech is perceived as a foreign accent to listeners rather than disordered speech. These accents may not have the same speech patterns as the accent they are perceived to have, which is referred to as a pseudo-foreign accent. There is uncertainty about if it is its own disorder or if it is a subtype of apraxia of speech. Foreign accent syndrome is not language specific. There are reports of individuals with a variety of different native languages who have developed FAS. Those affected were monolingual, bilingual, or multilingual. True native speakers of the perceived accent are often reported not sounding enough like their language. In addition, there is inconsistency among deviant speech characteristics, but typically is described by changes in sound production and prosody. These abnormalities include vowel changes, consonant changes, prosodic changes, and nonspecific changes. Deviant speech characteristics of vowels may include making vowels into diphthongs, distortions and prolongation of vowels, insertion of epenthetic vowels between words or at the end of CVC syllable shapes, for example, the intrusive schwa, omissions of unstressed vowels, equalization of vowel duration, vowel shifts, and increased vowel formant variability. Deviant speech characteristics of consonants may include voice, place, and manner distortions leading to perception of substitutions, poor control of voice onset time, such as pre-voicing of initial stops or overlap between voiced and voiceless consonant VOT, slightly off-target consonants, allophonic variations such as fronting alveolar consonants, anomalous consonant production such as voicing assimilation, production of full alveolar stops instead of flapping in medial position. And deviant speech characteristics of prosody may include alterations in stress, rhythm, and intonation, failure to reduce unstressed syllables within words, equalized syllabic stress, prolonged intervals, inappropriate pitch contours, restricted or large fundamental frequency excursions, abnormal melodic line, slow rate, reduced fluency, initial consonant blocking, and poor transition across word boundaries. Some perceptual and acoustic characteristics of foreign accent syndrome include non-native phonemes, broadening of phonemic boundaries, hesitancy and word searching, grammatical and syntactic errors, poor voice onset time control, abnormal variability, restricted vowel space, and poor co-articulation. The main etiologies of foreign accent syndrome are neurogenic, psychogenic, infection, and mixed. The neurogenic etiologies include stroke, closed head injury, brain tumors, multiple sclerosis, dementia, and primary progressive aphasia. The psychogenic or functional etiology of FAS include conversion disorder, schizophrenia, bipolar disorder, obsessive compulsive disorder, mania, post-traumatic stress disorder, and could be a combination of a bunch of these. FAS following infection of COVID-19 has been found to be associated with a wide range of neurological and psychiatric symptoms. Cases of FAS following COVID infection are limited but still have been reported. Associated deficits include aphasia, apraxia of speech, and nonverbal oral apraxia. Here are some examples of foreign accent syndrome I found on YouTube. Please take a look if you are interested. Treatment of foreign accent syndrome depends on the cause, but some patients may recover rapidly without any intervention. FAS's frequent association with AOS may suggest it may be appropriate to modify principles and techniques for managing AOS. The most attention should be on the vowel distortions that contribute to the perception of an accent. Treatment would also target voicing, place, and manner distortions, substitutions, and allophonic variations, and consonant production. Techniques used for managing prosody, stress, rhythm, and naturalness in dysarthria and AOS can be used. In cases of psychogenic functional origin, symptomatic therapy, medication, psychotherapy, speech therapy, cognitive behavioral therapy, or a combination of these interventions may be beneficial in making a complete recovery. Here are my resources, and I hope you learned something about foreign accent syndrome today. Thank you.